Okay, welcome everyone to today's webinar organized by Napo on the next steps in ending violence against women and girls, developing an epicram approach for HMPPS. My name is Anushka Valent. I'm the lead official for Women in Napo, and we're organizing this webinar today in advance of tomorrow's important meeting, important White Ribbon Day, which is a special day and time to raise awareness about preventing gender-based violence. Without further ado, I would like to welcome Keiran McCartan. Keiran is a professor of criminology and health at the University of the West of England, Bristol. Keiran has extensive research and publication track record going back over 20 years on understanding and responding to sexual abuse, as well as trauma-informed practice and criminal justice workforce development. He has advised many national and international governments as well as organizations. Keiran is the chair-elect of National Organization for the Treatment of Abuse, NOTA, the chair of the Working Group on Violence Against Women and Girls for the Confederation of European Probation, CEP, and a member of the board of the Risk Management Authority Scotland.
Thank you, and thank you for having me and inviting me to speak. So I'm going to share my screen now. Okay, so thank you for having me to talk around this and this issue. So what I'm going to do is talk a little bit about gender-based violence, violence against women and girls, and maybe sort of challenge some conceptions around that, and maybe whether we should be starting to think about violence against women and children, how this fits in with a public health approach, and how we can start to think differently about these issues and actually what it means for probation going forward. I just want to start off by talking a little bit about gender-based violence and what it is and how we can understand this. What is gender-based violence? So gender-based violence is quite a contested area in a lot of respects, and the term violence in and of itself is a challenging concept, because I think when we talk about violence, a lot of people make assumptions that we're talking about physical violence and physical harm. And although that is a part of gender-based violence and what we understand by gender-based violence, there is a lot more to it than that. Gender-based violence can be emotional, it can be financial, it can be a lot of different behaviors. And I think in reality, we need to be talking about gender-based behavior, because when we think about violence, violence has certain connotations to it. And I think sometimes it doesn't help victims and survivors of gender-based abuse or gender-based behavior to think about only the most extreme version of violence being the only type of behavior that is accepted and understood and processed by other people around that. So actually, in moving away from the term violence in and of itself, we're opening up the conversation about the reality of the range of behaviors that people experience around this. And we need to be quite victim-centered in a lot of our thinking, because actually framing the conversation in a victim-centered way really helps us understand and drive the debate and conversation forward. So when we talk about violence against women and girls, I think that is true. The vast majority of violence is perpetrated by men against women and girls. And that is a really important thing to recognize, and that is really important to acknowledge. And it's acknowledged in policies, in practices, in the way that we talk about things, both at a UK level and at a HMPPS level, but also more broadly by the UN, by the European Union, by lots of different organizations. But the challenge around it is that actually, in talking permanently about violence against women and girls, we're taking young boys and men out of the equation. And actually, that can be quite problematic, because a lot of the violence that we're talking about is also happening to young men and boys as well. So in thinking through how we should be engaging in the process and engaging in the conversation, we need to think about who all the victims are and how we can engage and interpret and move this conversation forward in a meaningful way. So, one of the challenges that we have is, while recognizing that violence against women and girls is a male perpetrated in the main issue, and that women and girls are the victims mainly of this, do we also need to consider how we make this the most accessible terminology and the most accessible definition that we have, and how we recognize the victimization at times of some young men and boys in this abuse, in this violence, without detracting from the victimization of women and girls. It's a really, really important conversation, and I think that's what we need to be doing. We need to be having these conversations and to really understand the terminology that we're using and why we're using the terminology in the way that we are, and not just accepting terminology because that's the commonplace terminology or the commonplace approach. That actually we need to think through why we're using this. So, what is some of the prevalence of this? And so, after having said everything about terminology, you can see that I'm shifting back into women and girls, but that's actually how a lot of this is characterized and defined. So, globally, there's an estimated 7.3 million women. Almost one in three have experienced some physical and/or sexual inter-partner violence across their lifespan. That's a massive number. That's a huge number. And it's really important that we acknowledge and honor and respect that. So, what we're talking about is a significant local, national, and global issue that affects one in three women. That's a huge, huge number. So, thinking about that, we have to start to think about how we tackle that at each level, don't we? We have to start thinking about how we respond to that with individual women and girls, but also how nationally we respond to that and how transnationally and globally we respond to that as well. And it's really important to think about that in the context of marriage, in the context of relationships, but also in the broader context as well. And we do know from years and years of research that most victims of sexual and physical violence are victims by someone that they know. That interpartner violence is a massive contributor to violence against women and girls. So when we start to think about how we can prevent and respond and approach this, we have to think of it inside the marriage as well as outside of the marriages as well. Okay. So the global evidence is most recent surveys show that online partner violence is a massive issue. We did a piece of research a few years ago as part of the Violence Against Women and Girls agenda, looking at violence against women and girls in public spaces. So this was funded by the Home Office. It came out of the Sarah Everard case. And the interesting conversation about that was, what is a public space? And certainly the funding and the funders were talking about physical public spaces, so parks, green areas, city centres. But actually, the question that was raised as a consequence of this is, what is a public space? Is the online environment a public space? And I think we've really got to start thinking about online harms in very different ways. So, what our research showed is that interpartner violence, sexual abuse, violence against women and girls may start in one sphere, it may start in the online sphere and then move into the physical in-person sphere. They're interchangeable, especially for the younger generation think very differently about the on and offline world, and they see it as seamless transitions between the two. They don't see them as very different environments, they see them as the same environment. And abuse and harassment can start in one and end in the other and move backwards and forwards. They're transitionary. And that's really important to recognize as professionals, but also really important to recognize as people. So sexual abuse in the online world and domestic violence in the online world has an impact in the offline world, and actually really makes us start to think and process and acknowledge what this looks like. And that means a lot for prevention and about how we prevent this abuse, but also about how we respond to and how we engage in this abuse as well. So I often get asked the question of, there's been an increase in violence against women and girls. There's an increase in violence against children, in child abuse, in rape. And why is this? And I think we have to be a little bit cautious when we talk about this. I think there potentially may be more, but in talking about it, we raise the profile of it, and victims and survivors feel more comfortable and more confident in coming forward and seeking support. That actually we're engaged in conversations in society more and more about this. That actually the Crime Prosecution Service is pushing for more convictions, and that's a good thing. If people, the victims and survivors feel heard and feel acknowledged, the police take it seriously and engage in the process around it. More cases are getting to court, there are more prosecutions. People feel more able to talk around this and to acknowledge and to process this. So there's been a massive shift in the accessibility of the conversation around violence against women and children. And so what we have to really start to think about is there an increase, or do people feel that they can actually discuss what is happening? So are we seeing a broader light being shedded on the topic and on the issue, rather than there being more cases of sexual abuse and domestic violence and interpersonal violence? Are people more able to recognize the warning signs? And going back to that earlier comment about shifting ideas around violence, do people realize the coercive control? Do they recognize emotional abuse and financial control in a very different and a very real and meaningful way? So when we talk about rises and increases and prevalence, we've got to keep in mind that we're talking about an offence and a series of offences that were hidden for such a long period of time. And actually, is some of this increases really about shifting perceptions and how we understand this and how we move forward with this? So I just really want to clarify and to really centralize this. Violence against women and girls and children is a male issue that affects and impacts women and children. It's really important that men own this issue, that men own their role in this issue, and that they come to the table to discuss, not from a place of defense and a place of reaction, but from a meaningful place, that they say, actually, this is a men's issue. This is a men's health issue. This is a men's psychological well-being issue that negatively impacts women and children. They've got to own the issue and be part of the conversation and part of the process about changing it. It has to be inclusive. They have to be brought to the table, and they have to own the challenges in the way that their behavior and men's behavior affects other people. So in thinking about this, we have to think about the role of the life course. We have to think about how we understand offending behavior, the importance of actually engaging with people across their lifespan, because quite often by the time someone reaches the prison and probation service, they've committed a serious offence, they've been arrested and are prosecuted for it, they've entered the system. So we need to think about all the behaviours that led up to that point, and actually how we can dynamically engage them in a process of change and behavior management. I always talk about and think about risk and risk management, and it's an interesting concept, because I think for too long we see probation as the holders of risk, the managers of risky people. But actually, the role of probation, in my eyes, is to think about how we help people understand the risks that they pose to other people, and how we can engage them in their own active risk management. It's really, really important that they own the risk that they pose to others. And that really is about the life course. That's really about understanding their journey, who they are as individuals, and actually how they got to the point where they engaged in this risky behavior. And so they can understand their triggers and how best to not engage in those risky behaviors again in the future. So one of the ways that we can think about this is through a sort of a public health founded approach, an an epidemiological criminology approach, which allows us to think about the individual, the interpersonal, the societal, that allows us to think about what's going on inside us. So our biology, our social interactions, the people that we surround ourselves with, our psychology, our motivations, because all of these things come together in offending behavior. So when we think about offending behavior, we need to move beyond thinking about the index offense. The index offense is possibly the worst thing that someone's done, but they did that in a biopsychosocial context. And certainly in prisons and probation, that's the way that we view offending behavior. That's the way that we view risk assessment and treatment and engagement and integration. So in thinking this through, we've got to really start to understand the life course and the dynamic interactions that people have with each other and with themselves. So in thinking through the reality of how we prevent and respond to violence against women and girls and violence against women and children, we've got to really sort of take an individualized approach. And that means understanding the person in front of us, understanding their biology. Do they have additional needs? Do they have um, psychological illnesses? How do we think about well-being? How do we think about how they have offended and the ways in which they've offended and how they've got to that point? So a health approach allows us to open up the conversation beyond just criminal justice sanctions, to really think about the person in front of us and then think about how do we stop them from offending again in the future, and how do we pro-socially integrate them. So one of the things that I will always say is I don't talk about reintegration, I talk about integration. And that really matters, because one of the reasons why a lot of these men committed violence against women and girls and violence against women and children is because they weren't pro-socially integrated in the first place. So our role is to help them manage their risk and to help them become pro-socially integrated as they move forward. So a public health approach sort of focuses around two very clear things. One is a socio-ecological model. So that's how we engage with people in different ways. So the first level is the individual. So how the individual thinks about and understands their offending or antisocial or problematic behavior, and how we understand to engage with them around that. So that is the biopsychosocial approach. That is thinking about the dynamics of their offending behavior and how we integrate and work and challenge them around it. The second level is the interpersonal. So that dynamic between themselves and their victims, or themselves and the people surrounding them, the close interpersonal relationships that they have with people, and how they understand those dynamics, and how that helps them understand their behaviors, their triggers, and actually how they can manage their risk and risky behaviors. The next one's the community, and we're members of many, many different communities, and so are the people that we work with. Communities that can support problematic thinking and cognitive distortions, and the ways in which they have distorted thinking about maybe women and girls, women and children. So actually how we can challenge that, but also communities that come back and sort of make them think differently about that. And ways to think about this is we are often members of various different communities. And do we talk about the work that we do? Do we talk about the engagements that we have in the same way in those different communities? Or do we maybe water down some of our dialogue, not talk about certain things with some communities? So If we think about ourselves as parents, do we go to the school and talk about violence against women and girls and violence against women and children in the same way that we might in a work meeting, in a dialogue, in a conversation? If we're sitting down with someone who's offended, do we think and talk to them in the same way that we would talk to our children about these things? So we have different discourses for different communities, and so do the men that we work with. So the challenge is, how do we frame and reframe some of these issues in a way that allows communities and to understand them and them to understand their interactions with communities. And then the last one is societal, and this is the one that's maybe the hardest to shift. How do we change social norms? How do we change social values? And I think, as I said before, this is starting to shift. We are talking more about violence against women and girls and violence against women and children in society. There is more of a dialogue than there was 20, 30, 40 years ago. But I still don't think that we talk about it to the degree that we need to. So how do we change relationships and sex education conversations in schools? How do we get and bring communities and societies and social norms and values on board? So if you look at stuff like the Me Too movement, how does Me Too shift social values and shift social norms when actually most people at an individual or an interpersonal or on a community level have bought into these, but changing social values is a really difficult, prolonged experience. So we'll change communities much sooner than we will change social values. And one of the things that I just want to say about that, I think it's really important. Violence against women and girls and violence against women and children is a community issue. A lot of the men that commit this violence come from communities and go back into communities. So communities need to be at the core of how we think about this. And certainly from a HMPPS point of view, communities and community action is a really powerful sentiment and motivation. We think a lot about how we get the individual to think about their behavior and to manage their behavior, and how we get them to operate on an interpersonal level, but we need to think about community and community approaches. It also gets us to think about prevention. And typically, probation sits in the tertiary and quaternary prevention sphere. But we've got to think about actually how we move that upstream, how we use our learning to involve communities, how we get the conversation out there, but also how we think about how we need to take our knowledge of risk and risk management and community engagement and move that upstream to really work with our colleagues in the third sector, to work with our colleagues in the police, to get them to think about and engage in different levels and different ways of prevention with knowledge. So primary prevention is about broad-based social knowledge and values. So actually, how do we communicate about gender-based violence and violence against women and girls and women and children at a broad community level? The second one is secondary prevention, is how we work with at-risk populations. So how do we get people who are maybe in the early stages of offending to recognize their problematic behavior, their attitudes towards violence, towards violence in general, but also the acceptability of that violence against women and girls, and how do we get them to start thinking differently? How do we intervene before it happens? How do we get people who are risky and problematic to really understand and engage with their behavior? Then tertiary is after the offending occurs and someone's entered the criminal justice system. So that could be prison, that could be police, that is quite often probation. So how do we do harm reduction? How do we stop future offending? How do we reduce problematic behavior in the risk management process? And then quaternary is a principle of do no harm. So how do we streamline services to make sure that people, when they re-enter society, are engaged in pro-social behavior? So how do we align policies and practices? How do we align services to make sure that actually we're not doing any further harm to other people, that actually the system doesn't make matters worse for people who are in the system? So a really good example of this is something like medication management. So I'm diabetic. So I have an annual review every year where I will go and see my doctor. They will look at all my medication and they will make sure that some of my medication isn't making me worse and making my diabetes worse. So actually streamlining that medication process. So how do we do that in criminal justice? How do we continue to work in a trauma-informed harm reduction way to integrate people in a pro-social way? And that can be quite challenging, but that's what we're in the business of and the job that we're in the business of. So taking an epicrim approach is something that we're seeing across the board. So the diagram that you can see here is a diagram that was prepared by the Council of Europe. So they see ending violence against women and girls as a central issue. So they're now working towards the development of a prevention of child sexual abuse Centre for Expertise. They do a lot of work around prevention and engagement in prevention across all levels. So we need to start thinking about, from our perspective, from a HMPPS perspective, how do we engage across all 4 prevention levels, and how do we engage across the entire socio-ecological system? So using this model as a way of thinking about it and thinking through it and developing fit for guidance practice, policies, and work. So the axis of this, we need to think, first of all, across the socio-ecological model, the 4 stages. So individual, interpersonal, community, and societal. We need to think across the primary, secondary, tertiary, and quaternary stages, but we need to do this in a shared multi-agency way. Preventing and responding to violence against women and children and women and girls is a multi-agency issue. And we see this through things like MAPA, we see this through things like MARAC, and we see this through the work that we do with different agencies and how we risk manage and reduce offending behaviour and engage with it. So the question is, how do we roll that forward? How do we engage organisations and companies and to think about prevention? How do we take our knowledge of managing risk and sort of help prevent violence against women and girls before it happens? How do we engage in the system that sort of is more pro-social and preventative, rather than a system where actually we don't want people to be entering the system? We don't want people to be entering prison and probation because they have been prevented from causing harm and we've reduced victims. So a public health approach is a no more victims approach that really advocates for preventing harm before it occurs. So what I've put in on the image is a couple of reports and a couple of active programs. So the first one, it's time to talk about it. That is 2PS, that's a European funded project. And they developed the Step to Support platform. So this is for men, generally men or people who are at risk of committing child sexual abuse. So that's secondary prevention. So they can go on, seek help, seek advice, and be directed to programs that can offer them insights into their behaviour. The second one is a report that I developed with Working with Perpetrators, which is a European project that looks to reduce domestic violence and sexual abuse and violence against women and girls. And so this is an overview of different programs and interventions that exist across Europe in line with the Istanbul Convention and how we can sort of work to develop that. And then the last one is a scoping review that I did with ECPAC International that looks at law enforcement prevention of sexual abuse and sexual harm. So actually what the law enforcement do and how can they engage in it better. So these are all freely available. If people want copies of anything, I'm very happy to share any of this with you. So what does this mean for probation moving forward? If we're saying that we take an epicrim approach, a public health approach, we frame things in the biopsychosocial model, if we start to think about health and well-being as a way to engage with people who have committed violence against women and children and violence against women and girls, what does this mean practically? Well, we see offending behavior as a health and well-being issue. So that's really important, not only for victims and survivors, but also for people who have caused this harm. Seeing it as a well-being, health and well-being issue opens up the range of agencies and organisations we can bring to the table, and allows us to reframe our thinking around risk and risk management in a slightly different way, balancing different service user rights. So actually, how do we promote positive health and positive well-being in the populations that we work with, and how do we engage them in understanding that their offending behavior, the violence that they're committing against women and girls and women and children, is as a result of health inequalities, as a result of mental health, biological health, and social engagement and social interaction. And how do we help them understand how to better frame it in that way? That we invest in staff training and staff support so they have specialized skills to work on this topic and this issue with this population. Trauma informed training for staff and well-being is so important. If you have a better equipped, better trained, better upskilled staff, you can engage really challenging issues and clients in very different ways. So staff development is a really important issue. Continuing to invest in becoming trauma informed, this is really important. A lot of the men that we work with around violence against women and children and violence against women and girls have trauma histories. We know that people in prison and probation have trauma backgrounds. And if we actually take a trauma informed approach and start thinking about how we invest better in victim services, we can stop a lot of the sexual abuse, domestic violence, interpersonal violence that we see in this populations. So actually, being trauma informed is being victim centric and actually allowing us to sort of intervene and engage with victim services more effectively to stop offending behavior. Contribute to quaternary prevention, community integration. So how do we support and work with place NGOs, charities, third sector organisations to pro-socially engage individuals as they move through the system and as they move back into the community? With the crisis in prisons at the minute, with the overcrowding, the release of low risk individuals and low risk people, how do we support that community integration in a very effective, very targeted way so that people aren't going back to prison, they don't breach, they don't recall, they don't continue their problematic behavior? Using our knowledge of service user behavior and etiology to inform primary and secondary prevention. How do we roll our skills upstream to actually help our partners to better understand the client groups that we work with so that they can better identify problematic individuals earlier on and actually intervene? And to work across the socio-ecological model in a rounded way, to actually think about how we work with people individually, to think about how we engage with them, to think about their interpersonal relationships in a different way, their community return, community engagement, and then to start thinking about how they can understand how society thinks about them and how we can start to change some of the conversations. The reality of this is violence against women and girls and violence against women and children is a social issue because it's so common and it's so prevalent. It's probably a lot higher than 1 in 3. It's probably closer to 1 in 2 or even higher than that. So the reality of this is, how do we change the social narrative around this? Because actually in changing the social narrative and understanding that anyone is potentially capable of this, then that will help with inclusion and will help with return to society, and continue to educate communities about the reality of violence against women and children. So I'm just going to end the presentation there and uh, open it up for any questions, comments, or reflections upon what I've been talking about.
Yes, thank you, Keiran. This is an excellent presentation. Like I hope that's very thought-provoking. What for me, what I kind of felt on the societal aspect of that you said, I think with the rise of the far right, and like the increased populism, I think that probably for me, I think whether that has an impact, because that far right has the reactionary view on women, and like the misogynistic sort of kind of view that comes in around it. I think you had Elon Musk intervening that time ago in the Rochdale around the child sexual abuse cases, and attacking Jess Phillips and the government over it, and then asking for the release of Robertson, saying he was out there to protecting women. When we know that was not from that point of view. And then I think the adolescent series as well, that's recently been on around the misogynistic in school as well. And I think what's also important is for us that you say it's to promote the work that the practitioners do in keeping the public safe, because I think that's enough what our members say is like people don't know what we do because we do a good job. We only hear about probation when it goes wrong, when there's a serious further offense.
I am the biggest advocate of probation because I think the challenge with probation is you are right. People only hear in worst case scenarios. Probation, for whatever reason, is really poor at sort of trumpeting and platforming its success. So we will hear about a serious breach or a return or something like that, but no one talks about the thousands and thousands of people that are successfully kept on license every single day and how people engage in that. And I think the challenge is, I think quite a lot. So, for instance, last week I was in Latvia talking at their national probation conference, and I asked them the question: if I went out into the street in Riga and asked people what probation was, would people be able to tell me? And no, they sort of fed back, well, people think that we're maybe social workers or police, or they don't really know what we are. But I could go out in Bristol now, I could leave my house and go out into Bristol and ask people what the probation service is, and they'll probably get the same answer. And so I think probation has to. I think people need to understand what probation is, and I don't think they do. And I think that there's a very clear argument that probation has a strong skill set that actually keeps communities safe and manages difficult and challenging people. And we've got to sort of see and respect that in a climate where actually, you are right. The far right is on the increase. Even the right is on the increase as well. And misogyny is commonplace and just acceptable. Like, I'll give you a really good example of this. So the school my son goes to, when the whole Andrew Tate case started to come out and started to happen when he was arrested, I said to him, are they going to talk about Tate and toxic masculinity in school? Are they going to talk about that? And his answer was, well, we were told that they wouldn't talk about it just in case some kids didn't know who Tate was, and if they mentioned it, they would go and look him up. I'm like, but that's the wrong answer. That's not the way to talk about it or the way to engage about it. But we need to be having these conversations, these difficult conversations. We don't want to talk about sexual abuse or domestic violence or violence against women and girls or women and children, but we need to have these conversations, otherwise people will just think it's acceptable to hold those beliefs.
I don't know if it's accurate or not from Esther, but I've read things that indicate a lot of right-wing protesters against asylum seekers have a history of domestic abuse, violence against women in their history.
I don't know the answer to that, and I couldn't answer that. My perspective on that would be you would need to look at everything at a individual level, and you need to sort of think about the person in front of you. But what I would say is that there might be an alignment between that, because aspects of control, misogyny, things like that fit in with some of the right-wing ideology that you would say, and fit in with some of the racism and racism that you would say as well. So I wouldn't like to say that that's definitely true, but that would sort of make sense. because the ideologies would align.
Somebody also put in the chat 41% of the Southport rioters that were arrested had domestic abuse offenses. So that's.
But because what you're seeing there is you're seeing an acceptability of violence, aren't you? You're seeing that actually these are people who have attitudes and views that a certain degree of um, abuse or violence or a certain reaction to things are acceptable. So you know the psychology of it is it's fascinating. Like the psychology of going and standing in the street and protesting, that's not something that people do lightly, is it? You know, because you're out there, you're in public, you'll be seen, you might be caught on camera, your boss will see you, your colleagues will see you. So there is something about that. There's something about actually getting to a point where you feel that that's acceptable and you feel that that's not difficult or challenging, where actually a lot of people would say, I might hold those views, but I'm not going to go and stand on a street corner and see that. So if they're that way inclined and that's acceptable to them, then what you might see is other forms of sort of harassment, abuse are also acceptable to them because they've sort of reached a platform with their protests that make them obvious to everyone else. So yeah, it doesn't surprise me. It's the first time I've heard that, but it doesn't surprise me.
Also, I agree that the problem is majority male focused. There is an increasing population of female offenders. Just wanted to make that clear. It's an issue for everyone to offend to manage. And as I wrote in the chat earlier on, a lot of um, young men and young women, due to sexual educations and what is correct and what is proper and legal within the country is it just isn't there at a level at which that they can absorb this information. And I don't know if it's maybe when I was a lot younger, unfortunately many years ago now, that sexual education was part of a national curriculum and you was told not only the fundamentals of how the acts work and such, but also you were given pro-social modeling for what a healthy relationship actually looks like and how to manage those exact those situations when arguments would come across like in a school classroom between a male and a female, that it wouldn't just be a case of one person being shouted down and things like there'll be an open debate, open questions, open arguments about things. And there's not enough focus on getting to the root of this problem at a young age where, let's be honest, that is where the real change is going to be able to take effect. I look at things as kind of like driving along a motorway, and before you get to that last turn off of sexual offending, you've got all this roadway in which to divert people from, and the sooner you get to them, the easier it is, because further down the road it becomes a harder and harder turn, and some people just cannot make that turn, and it's just where like but I also want to see more structure in place for those who come forward and say, okay, look, I'm having these thoughts, I'm having these issues. Where, like, how do I manage it? What can I do? Where can I go for things? And I I, I want it to be able for my nieces when they're growing up, my nephews, to be able to put their hand up or contact an agency and say, look, this person or this screen name, this thing has been contacting me and asking me for this, and this, like anonymously, if they so wish, to be able to say, look, and it goes to an agency that goes like the Napo agency, for example, Children's Protective Services, where investigations can then be linked to that IP address, that username, so we can build a database of the names these people is using to so we can track them down a bit easier, and then we can intervene earlier. And I don't know, it's a very tricky area. It's a lot of very simple answers, but not a lot of effective long-term solutions, I feel.
I completely agree with you, and I would say that we need to have a serious conversation about relationships and sex education in this country. Like the reality of it is, you know, we can't be afraid to talk to children and young people about these things. And I think sometimes we're guilty of saying, well, that's a family issue or that's a personal issue. But we've got no guarantee it's being talked about at home because it's not being talked about in the community. It's not being talked about in other places. So I think we need to have a realistic conversation and a realistic understanding of not only things like relationships, but also things like pornography, things like violence, things like social acceptability. We've got to have these conversations, but I think sometimes policymakers or governments are scared of putting too much in the classroom. But the debate needs to happen. I think if we have a fully effective primary prevention approach, that actually, if we're upfront and honest, then people will have conversations. People will feel comfortable coming forward and sort of seeking help and seeking support from other organisations. Just in regards to your women's comment as well, yes, I don't disagree with that. We are seeing more and more female violence and female offending, but the stark reality of it is the vast majority of people in the system who have been arrested for violence against women and children are men. So, but yeah, but we need to treat women differently in the sense that I think sometimes in the past we've been guilty of going, this is everything we know about violence against women and children. It's the same for men and women. Men and women offend for different reasons. They partake in behaviors for different reasons. So I think if we're going to have a serious conversation about it, I think we then need to have a serious conversation of what is different for women when they engage again in violence against men, violence against other women, or violence against children, and how do we make sure that we understand that from a realistic point of view, and then engage in not only good preventative treatment but also good responsive treatments as well.
Thanks. Thanks. We asked the discussion draw parallels between sexual and physical violence. However, do you think that there are any differences in terms of the level of seriousness of impact upon victims? Also, given that a lot of violence against women is perpetrated online via social media, what is your approach to social media as a platform for communication, given that, as aforementioned, any individual is a potential perpetrator of violence against women?
So really, really interesting. So the first one was so the second one was about online and online platforms. Then the first one was about dangerousness. I think one of the things that I would say about dangerousness is I've done a lot of work with victims over the years, and one of the things that I will hear a lot from victims is I often feel like I'm being worked to rather than worked with. So the question is how we bring victims to the table, how we see what victims and survivors want, and how we engage with them on this. And that means that we can't really interpret levels of dangerousness. The victims, some victims will be really negatively affected by online sexual harassment or online verbal harassment in a way that others won't be. And so I think quite often, a lot of the time, we hear victims say, well, that didn't affect me in that way, but I was sort of made to feel that I should have been affected by it. So I don't really understand what they want from me or what they need from me. And I think sometimes we go to victims expecting a certain response, and when we don't get it, we're like, oh, well, it obviously didn't affect you that much then. So I think the challenge is, I think they can all affect people, and they can all affect people quite significantly. But I think it needs to be looked at in the round, and we need to be able to say, look, all forms of violence and aggression and sexual abuse are wrong. Whether it's written, whether it's said, or whether it's actually performed, the reality of it is it can have an impact upon the victim. So we need to understand in victim interviews and testimonies and engagement the level of impact that that has had on the individual victim and how best to support them in moving forward in regards to that. And what I would say about online is significant. And we don't know. So we know the consequences of physical violence, physical sexual abuse and rape and stuff like that, because we've had 30 to 40 years of research and practitioner knowledge on this. A lot of the work that we're looking at now, we're only really 10 to 15 years, maybe the third, fourth generation of people going through online sexual abuse and harassment, and we don't know the ongoing consequences of that. We don't know the lifelong consequences or impact, and we're still learning about this as we move forward. So thinking about things like, we know the impact of sexual abuse, but we don't know the impact of you know, online exploitation, sexual exploitation, because a lot of the victims of that are sort of growing and developing as we're moving forward. So we will know that in maybe 10, 15 years, we'll have a much better understanding of it now. But at the minute, we have to just work on the premise that it does cause harm, and it will cause harm. And actually, I think, to be fair to victims and everyone else who's involved in this work, we have to sort of see it maybe as potentially equitable with physical violence, because victims may interpret online sexual harassment, sexual violence, and stalking behavior the same as offline versions of the same thing. We can't decide for the victim. So until we get a much more detailed evidence base, we have to think about it on a scale of impacts, and that potentially the online sexual abuse, harassment, and coercion are interpreted the same by victims as offline versions of the same thing.
Thank you so much again.